name is Shauna. I'm a nurse practitioner. I'm going to be doing your examination on your abdomen today. While I wash my hands, can you tell me your name and birthday?
LaQuisha Jones,
And your birthday, LaQuisha?
11/13/69.
Fantastic. Under normal circumstances, if this was an actual patient, I would have her lift her shirt so I can inspect her abdomen, but for privacy's sake, we won't do that today. Are you having any pain or discomfort?
Nope.
Okay. So I would lift her shirt up. I would examine the abdomen for any masses, pulsations, discoloration, distension, which she doesn't have. Next, I'm going to listen to all 4 quadrants, starting with the right upper, left upper quadrant, right lower quadrant, and the left lower quadrant. I'm listening for vowel sounds, and they should be, I should hear 5 to 30 per minute. Next, I'm going to listen for the splenic, friction rub on the left side. Which I'll locate her spleen, which I don't hear any. I'll go to the right and listen for a liver or hepatic friction rub, which I don't hear. Next, I'm gonna auscultate the aorta. I'm gonna check the iliac arteries on both sides, the renal arteries on both sides, and then I would check the femoral arteries on both sides. Listen for any abnormalities, such as bruit or pulsations. Next, I'm going to percuss, get down on my knees, percuss the 4 quadrants again, where I take my hand of my middle finger of my dominant hand and tap all 4 quadrants, and they should be, listen for tympanic sounds. Next, I'm going to go to the right upper quadrant and palpate for the liver. And then I'm going to measure the liver border by going under the costal margin, going to the mid-clavicular, counting down, and I should feel the border of the liver, which should be no more than 4 to 7 centimeters. I'm going to just reach over under the 10th rib, locate the spleen, palpate. I should not feel the spleen, which I don't. If I did, that would mean that it was enlarged. No enlargement there. Next, we're going to check to see for signs of appendicitis, cholecystitis, and peritonitis and those sort of things. I'm going to go to first I'm going to do the liver hooking test to palpate the liver. And I'm going to check for cholecystitis. I'm going to press in the right upper quadrant and ask when I let go if you have any pain. No? And then I'm going to check the ACEs, which is the anterior superior iliac spine. Find her umbilicus, go in between to McBurney's point, and see if she has any pain or tenderness there. If she did, that could also be a sign of appendicitis. I'm going to again check for rebound tenderness when I press in the right upper quadrant, and press and then release. Ask if she has any pain. Is it more pain? If there was more pain when I released, that also could be a sign of appendicitis. Robson is sign. I'm going to press on the left side of her abdomen and ask if she has pain on the right side. When I release, no pain. Ileosis test. I'm going to have her bend her knee. I'm going to press down while she raises up on the the right side. If she had pain on the right side, that could be appendicitis. I'm gonna try again on the left side, lift your knee up. I'm gonna press down. If she had any pain, that could either be appendicitis or on the left side it could be peritoneal inflammation. The obturator test, I'm gonna have her, she would lay flat, have her raise her knee. I'm gonna internally rotate it, externally rotate it. If she had pain, that could also be a sign of appendicitis or peritoneal inflammation. For ascites, I'm going to I'm gonna have her lay flat, have her put her hand midline and do the wave test. And I would push on the right side, and if I saw fluid shift on the left side, and if I push on the left side and see fluid shift on the right side, that could be a sign of ascites. I could also percuss if she had ascites. The fluid while she's laying on her back would shift to her sides, and when I percussed the abdomen, it would be tympanic because it would be air here and the fluid would be on the side. I would have her turn on her left side, and the fluid would shift to the dependent side, and I could palpate the flank, and it would be tympanic because it would be air instead of fluid. And that concludes my examination of the abdomen. Thank you very much.